In this video, we will explore stress as trauma. The learning objectives for today are 1. To identify ways in which stress may manifest itself in those with childhood trauma. 2. To better understand how trauma can persist into adulthood. And 3. To learn how stress can impede daily functioning. As we know, intense levels of stress can have profound physiological and psychological impacts on an individual. Adverse childhood effects such as abuse, neglect, separation, family conflict, violence, accidents, and war can directly affect how people with childhood trauma react to and cope with their experiences as they become adults. Meet Jane. According to society, Jane leads a normal life. She is a teacher, has recently gotten married, and has many hobbies. However, recently, she has started to cope with her anxiety through alcohol consumption, and her loved ones are worried. They want Jane to get help, and they have encouraged her to visit a doctor. But Jane is scared and doesn't want to take medication. So what happens next?
I've known Jane since we were in grade school. We hung out all the time, and as soon as I started to see the impact of her parents fighting, and she would come over after school and be really upset. She'd spend evenings at my place, and it was hard to see her like that. She started to get a little bit more distant, a little bit more quiet over the years. I could see it really affecting her.
I hadn't seen Jane in 3 years. So when I saw her last weekend for a family gathering, I was quite surprised. First of all, I hadn't seen her drink so much since high school, and it was a little concerning. Second, she seemed very disengaged from our conversation, and it seemed like she couldn't really make sense of what was happening around her. She's changed, and I don't know what's happened.
Lately, I've been really concerned with my wife, Jane. She's been really irritable. Anytime we get into an argument and I maybe raise my voice, I'm not intending it to be aggressive at all, but she gets really upset by that. And I'm just really worried that something's wrong with her right now. I'm not really sure what's going on with her, but I've noticed that she's been drinking maybe a little more than she normally would. Maybe more than a couple drinks per night, so I'm a little concerned about that. I think Jane needs to talk to someone. She needs maybe a little more help than just medication can do for her, so I think she needs to reach out to someone.
Hi, I have an appointment for 11:30.
Okay.
Jane?
Yes. Okay, the doctor will be right with you. If you want to have a seat.
Thank you.
Hello, Jane. I'm Dr. Brown. Nice to meet you.
Yes, ma'am.
So tell me a little bit about what you've been experiencing.
I've just been feeling really anxious lately. The only thing really helping me is wine.
All right, so tell me about some times you've been feeling anxious.
It can be anything, big things, small things. The other day I knocked over a glass and then fell on the floor, and
yeah.
Jane? Hey, nice to meet you. You can come on up. All right, Jane, you can take a seat here. So how are you feeling today?
I've been doing okay, but feeling really anxious lately, and I went to my doctor the other day and she just prescribed me some anxiety medication, but I'm not really sure that's a path I feel comfortable going down.
Okay, so what's been making you anxious?
So it's been a little bit of everything. I can't really pinpoint what it is. I just kind of get a general anxiousness about me, and it started off small, but I've started to have some glasses of wine to help calm me down, and now it's almost 2 to 3 glasses a night before bed.
So is the drinking something that you're looking to change?
I don't know, right now drinking is really the only thing that's helping me, so if I'm gonna stop, I think I need to think about it a little bit more. I think I'm ready to talk about my anxiety now.
Okay, let's get started. Can you tell me about any times this week that you felt like having a glass of wine to calm yourself down?
Earlier this week, my husband and I got into a disagreement because we were talking about going out for dinner with some of our friends this weekend, and I just really didn't think that we had the time, but he was pretty insistent that it was something he wanted to do.
Okay, that seems like a fairly common disagreement to have. So what exactly was it that made you uncomfortable or anxious about that situation?
It just made me really uncomfortable, the way he raised his voice at me, and I think it just really reminded me of how my dad would sound. Like, he would yell at my mom, or like they would argue.
Okay, why don't we discuss more about your parents' relationship?
I just don't think I'm ready to talk about that right now.
Alright, why don't we come back to this topic another time? Would you like to end the session now, or do you want to continue?
I think I'm ready to go home now for today, and we can just come back to it next week or something.
Do you? Alright, James, so how are you feeling today?
I'm doing okay. I think I'm ready to talk about my parents' relationship now.
Alright, that's wonderful. So what are some things specifically that you remember?
When I was younger, I just remember them down the hall. They'd be screaming and yelling. Sometimes there'd be loud noises, like something was getting thrown against the wall.
What are you accusing me of? Why don't you say it to my face?
What are you talking
Why didn't
about?
you ever think about my problems?
Just lower your voice.
Lower my voice?
You said you wouldn't yell in front of the baby.
The baby. It's always the baby. What about me? I live here too. This is my house too. I work very, very hard to pay for this house.
And normally I didn't see anything. I would just be in my room. But one time I remember peeking around my doorway and seeing my dad hit my mom. And after that, it just wasn't really hidden from me as much anymore.
I can definitely understand why you feel uneasy and anxious in situations like this with your husband. Having traumatic experiences in your childhood can actually really affect your adult years. Anxiety and substance abuse are actually linked to traumatic experiences in childhood, which may help you feel like you're not alone in this. How about next session we'll work on some better ways to help you cope with these situations and these feelings.
Yeah, thank you for helping me talk about this. I really feel like a weight's been lifted off my shoulders now, and not needing to keep this inside anymore, and just actually talking about it and working it through with someone. So it's been a few months now since I first started therapy, and I really feel like it's made a big difference in my life. I understand why I'm getting so anxious now and where it's all coming from. I've learned to better cope with the disagreements I'm having with my husband. I don't get so worked up now if he even raises his voice a little bit or we're not getting along. I've just developed a lot better coping mechanisms. I'm not drinking anymore. I've quit, which has made a really big impact on how I've been able to manage my anxiety and working through my trauma and what happened with my parents and my mom and dad have just really helped.
Jane was a victim of childhood trauma. This resulted in her experiencing anxiety and using maladaptive coping mechanisms, such as drinking, to deal with it. Her case demonstrated how with appropriate support and therapy, she could adopt positive coping strategies. As this video showed, this does not happen overnight. It does not occur with the wrong healthcare provider, and it does not usually occur when first suggested. Each individual must come to an understanding of their own experiences at their own pace. Otherwise, they may not be able to recognize the truth. Regardless of timing and situation, it is important to recognize that this is not the only way trauma may present itself. Rather, this clip is an example of how childhood trauma can present as anxiety and substance abuse later in life. This treatment resulted in a positive outcome for Jane, and she continues to work on positive coping mechanisms and strengthening her confidence.